presenting our Prescription Pal.
So a quick overview of what we're going to be talking about today. First, we're going to discuss the problem, then we're going to introduce our solution. Succeedingly, we're going to talk about our competitive advantages, then discuss our target audience, and lastly, our business model. So let's start off with the problem. So 2 out of 5 Americans will or have been affected by someone struggling with opioid abuse. In 2020, opioids were involved in 63,680 drug overdose deaths, which is 75% of all drug overdose deaths. In 2021, there was an estimated 22% increase in deaths from drug overdose. The opioid overdose epidemic has been almost silently ravaging through the United States, impacting over 20 million people with no end in sight. So with that being said, let's introduce our solution, Prescription Pal. Prescription Pal is a reusable, programmable pill bottle with the corresponding app that will accurately dispose of a precise amount of pills at the program time. Our pill bottle uniquely prevents customers from taking opioids at times of overdoses what is prescribed to them. Prescription Pal can be programmed remotely by healthcare providers through their app based on the level of pain described by the patient, even as it changes on a daily day-to-day basis. For example, if a patient is having a particularly difficult day, the doctor could allow a slightly higher dose of opioid versus a day with lighter pain in which the doctor could allow a lower amount of medicine to be dispensed. As mentioned before, Prescription Pal is a reusable metal pill bottle, meaning that multiple opioid prescriptions can be put in the same bottle. Future prescriptions may also be filled to the Prescription Pal, creating less plastic waste from plastic bottles. Additionally, the bottle itself is made out of a strong alloy of steel and aluminum, preventing patients from easily breaking into and accessing on excess of their prescription. Compared to its competitors, Prescription Pal has an immense competitive advantage, which John is going to touch on in a second.
So competitive is of Prescription Pal include its coordinating app, which is a feature that many other program prescription bottles do not contain. Additionally, customizable doses based on a patient's pain level from day to day is something that many other bottles cannot compare to. And we also take account for the fact that physicians are busy people, in that not only can physicians but caregivers of the patient may also be able to approve specific requests for pain for opioid prescriptions, but everything would be tracked in the app, so physicians would have access to these records at later dates. And finally, Prescription Pal fosters an increased beneficiary in terms of the patient-doctor relationships, which makes patients feel like they're more involved in their healthcare process and encourages a better quality of patient care. So the unique bottle mechanism of Prescription Pal is another part that sets it apart from its competitors, which is primarily shown in level 3 with the rotating gear that allows for pills to drop through to the second layer and the first layer for them to be dispensed, which is again a mechanism that many other pill bottles do not contain. In terms of our demographic, we're primarily targeting young adults from age 18 to 21 with low income and who have had past mental health or who have had family members with similar mental health problems, as these are the people most susceptible to overdosing on opioids. However, we are also targeting people who have had or will have opioid prescriptions in the future, as they may also be susceptible to overdosing on their prescribed opioids, and we would like to prevent that with Prescription Pal. Our major channels of distribution will be through primarily partnerships with pharmacies and hospitals, as we would be able to partner with them to get them to put opioid prescriptions into Prescription Pal, which will be, again, a major factor of our profit. But however, we will also be selling in our own independent channels in order to gain a separate amount of profit, as well as if people would like to just put their own prescriptions into a bottle, regardless of if it's an opioid or a novel prescription, just to help them keep track of it. Prescription Pal may also do that for them. In terms of our cost structure and revenue, this is for 2025, which in the timeline you'll see in the next slide is when we're expected to have established many of our partnerships. This is a rough overview of where we expect to make revenue, and we expect to break even. In terms of Prescription Pal much before 2025. However, 2025 is the first year we should see an exponential amount of profit and around the 1 million mark. In terms of our proposed timeline, 2022 to 2023, we expect to have a finished prototype that we can then take to market. So in early 2024, we can start marketing it on our own independent selling website, as well as creating partnerships with local pharmacies such as CVS, Walgreens, and Market Street and local hospitals in order to start selling Prescription Pal and getting it out into the market. By 2025, we hope to have these partnerships established firmly, and later on in 2026, move to national and international markets to expand Prescription Pal globally in order to provide help to everyone who may need it around the world. Well, that is all we have for Prescription Pal, and we hope that you choose to invest in the future of prescribed medications.